Hello, and welcome back to Flipped Psychology. I'm Miss Lee, and this video is going to cover drugs and consciousness. We are still in Unit 2, the biopsychology domain. This is Section 13. Our objective today is to explain the effects of drugs on consciousness. If you haven't done so already, go ahead and grab your notes, and let's get started. Okay, so there are a couple of different classifications of drugs that you need to know in order to be able to describe the effects of drugs on consciousness. We have depressants, stimulants, and hallucinogens. So let's talk about each one of them, and I will give you some examples. First of all, there are depressants. Depressants slow the activity of the nervous system, so it slows everything down, central and peripheral. And depressants give people a sense of relaxation, but they can also have very negative effects. One example of depressants is narcotics. Narcotics are addictive depressants that have been used to relieve pain and induce sleep and can give the user a feeling of pleasure. However, go back to that first word after you see narcotics. They are incredibly addictive. One of the worst problems that we've seen in medical history is happening right now, and that is what is known as the opioid crisis right now. So medications that look like opium, they are opium derived, they are depressants, and they can be prescribed as painkillers, but they are incredibly addictive. Next, we have stimulants. Stimulants increase the activity of the nervous system, both central and peripheral, and they speed up the heart and breathing rates. Stimulants include nicotine, amphetamines, caffeine, and cocaine. And then you have hallucinogens. Hallucinogens are drugs that produce hallucination. So let's go back and talk for just a few moments about stimulants. One of the most commonly used and abused stimulants is nicotine. Nicotine is a drug found in tobacco leaves that spurs the release of the hormone adrenaline. We've already talked about that when we talked about the endocrine system. And adrenaline causes your heart rate to increase. So you're going to have increased energy, but your heart rate is going to be increased. Amphetamines help people stay awake and reduce appetite. Cocaine is a stimulant derived from the leaves of the coca plant, and cocaine produces feelings of pleasure, reduces hunger, deadens pain, and boosts self-confidence. And then last but not least, good old caffeine, the most widely used and abused drug out there. Caffeine is found in coffee and soda, chocolate. Caffeine helps people stay alert and is the most commonly used drug. All right, so let's talk about the definition of addiction. It is now known as substance abuse disorder. So the DSM, which is our Diagnostic and Statistical Manual, which is a reference manual used by doctors and therapists, now considers drug addiction to fall under substance abuse disorder. That's the official name of it. The major symptom of drug addiction is compulsive drug-seeking behavior. So you continue to want the drug, look for it, try to get it in any way that you can. All right, so an example of that would be you sustain an injury, you receive painkillers from your doctor, opioids, and after the pain stops, you continue to try to use the opioids. You try to get more prescriptions. So you are using the substance even though the problem is no longer there. So even though you don't have the pain anymore, you continue to allow that opioid really to control your life. Or you try to use more opioid than is necessary to manage the pain level that you have. You can also develop an addiction to various things like drugs, but also alcohol, gambling, video games, sex, eating, and other dysfunctional levels of behavior. So even though some of these behaviors are behaviors that are considered normal, it's the level or dysfunction around the behavior that makes the addiction a problem. Tolerance is a term that is referencing a person's diminished response to a drug after they've used it over and over again. The body basically becomes used to larger and larger amounts of the drug, and so increasing the dose is necessary to receive the same effect. So people can develop tolerance to both illicit and prescription medications. You can build up a tolerance to caffeine. Again, it's a physical effect of repeated use of drug, not necessarily a sign of addiction. And an example example of that is patients with chronic pain or maybe even a psychological disorder frequently develop tolerance to some effects of prescription drugs without actually developing an addiction to them. Dependence is a physiological state where if you stop using the drug abruptly, you could end up having some withdrawal symptoms. This is typically an expected outcome of chronic opioid therapy. People who abuse opioids, it is expected that they will develop a dependence on the drug. Other drugs that can produce physical dependence include beta blockers, caffeine, barbiturates, benzodiazepine, clonidine, and alcohol. So some of those are prescription drugs that are necessary for psychological and physiological disorders, but they can produce physical dependence. And dependence is more of a physical reliance on drugs. Addiction usually involves some type of emotional, mental, and physical dependence on the substance as well. All right, so very quick video. Let's recap. What we talked about today is how drugs affect our consciousness. We talked about the different kinds of drugs, which include stimulants, depressants, and hallucinogens. In our next video, we will be discussing other altered states of consciousness. I can't wait to see you then. Bye for now.